Mohammad Hassan, one of the cardiac surgeons at St. Michael's Hospital, work with Dr. Verma. So excited to be here, really privileged, and great work here.
Thank you, and thank you for all the work that you've done for this as well. But Subodh, maybe you were telling us a story of how this came about.
So the way this came about is, as you know, South Asians are at higher risk of cardiovascular disease, and we end up seeing a lot of patients who need bypass surgery who have. And over the last few years, the two of us have observed at St. Michael's Hospital at least 3 distinct cases where people, a few weeks after having had bypass surgery, when we see them in the office, they've had a quadruple bypass, and they wonder about fasting during Ramadan. And first and foremost, oftentimes when physicians give usual advice, you should be compliant to an ACE inhibitor, a statin, glucose lowering, etc. That's pretty prescriptive, and we're very comfortable with that. But when it came to these topics, it was extremely difficult. And in fact, I found that even though I was giving advice to individuals to say you should not fast, during this month, you've just had heart surgery, the response back was, but it is the fasting that actually will make me stronger and will get me through this. So, again, the need for physicians to be culturally sensitive and understanding the roots and the gravitas of Ramadan and what it means to people was imperative. And then I ran into Dr. Hassanin, as you know, in Dubai at the IDF meeting, and discussed this with him as he is leading a similar initiative as you are in the Middle East. And they've thought about this quite extensively. And I came back to Canada, and of course, who's better than Harpreet to actually move things forward in these kinds of areas? And Harpreet and Dr. Hassanin actually took the bull by the horn, if I may, and assembled this really outstanding group. So I think there is a great need. There's about 1.2 million Muslims in Canada, and growing fast. It's 60% of people who live in Toronto were not born in Toronto. And I think it is about time that we had some guidance for people to actually provide to our patients about safety and efficacy. And also there is a great need for physicians to understand the cultural roots as to why is it that people fast, why is it so important, and how can we incorporate their ideas and their plans into a culturally sensitive and safe sort of mechanism. So this is a great forum. Congratulations to all of your panelists. My job, my only role here was to actually make sure that this idea did not lose momentum, and I'm extremely thankful to you, Harpreet, for making sure that it's actually seeing the light of the day.
We're thankful to you for germinating the seed and also making sure that we stayed on track as well. So thank you so much. Dr. Ihsan, I'll ask you to comment on what Subodh mentioned, right?
I have to take your lead.
Thank you. So Subodh mentioned that even in the religion, there are allowances for people, so that some of the people who are sick, maybe pregnant women, maybe people who have complications, for example, the recent bypass surgery, let's say, to be an allowance is there for people that they can excuse themselves from the fasting month during that time as well. But as Subodh mentioned, and others like Mr. Binder have mentioned as well, that it's their passion and it's their belief that this fasting month will actually make them stronger, and still they want to fast. So what, as a physician, how do you deal with that, or how do you acknowledge their beliefs and also advise them, counsel them?
Yeah, so this has always been a very difficult question. Even as a Muslim and as a physician, I find it very difficult to answer, because there are no clear-cut guidelines. And it's a very individual-based question as well. Many times, individuals who have recently gone through surgery or have medical problems, they go and ask their imams what to do. Should I fast and should I not fast? And imam usually say, go and ask your doctor and just do whatever he says, that should be good. And unfortunately, even Muslim doctors don't have any guidelines to suggest whether an individual should fast or not fast. So I think this forum and your work to bring up all those guidelines to educate doctors, whether Muslim or non-Muslims, to how to treat these patients and how to advise these patients is very well needed. So excellent work here. It's such an individual, you can understand, Muslim, an individual is fasting from the age of 14 and 15 to 16, and they fast at it's a part of their culture, part of their religion. And then when they are old, just to tell them not to fast, it's a very difficult decision. And sometimes, even willingly, they are happy to take a risk to their lives. That, okay, that's fine, I'll take a risk and fast, and God will take care of it. But we need to understand, I'm not an imam here, but where God has asked, or Allah Ta'ala has asked people to fast, He has Himself has given concession not to fast when it is required not to fast. But sometimes it's very difficult to sync that or to get that message clearly. I think here our imams have to play a role to reinforce, just for an example, like when Muslims travel, they are allowed, or actually they are asked to shorten their prayers. But at the same time, when they are sick, or if there are any Sharia reason or a legal reason for them not to fast, I think it's important that they shouldn't fast as well.
Thank you. Thank you for being a part of this, Dr. Hassan, and thank you for making it to this event as well. We look for further collaboration in making sure that this message and the collaboration with the imams, as you mentioned, keeps moving forward. So thank you so much.
Thank you so much. Thank you.
Thank you. And now I'll invite Jovita. So on the agenda.
Hi, my name is Jovita Sundaramurthy, and I'm the VP Research and Education at Diabetes Canada.
And how long have you been with Diabetes Canada, Jovita?
20 years I've worked there.
Yeah, so you know all about it, right? Yeah. So let's talk about Diabetes Canada for a bit. So what is the mission, and how long has it been going, and what do we intend to do?
So Diabetes Canada was founded by Dr. Best. So we've been around since the 1950s. We just last year changed our name. We were the Canadian Diabetes Association, and now we are called Diabetes Canada. The mission of Diabetes Canada, I know Peter Sr. did mention it. It is to help people in the fight of diabetes, to prevent complications, and as well as to fund research to find a cure for diabetes. Mm-hmm. So that's the mission.
Yeah, excellent. And then, so Diabetes Canada has guidelines in general for healthcare providers and other people as well, people living with diabetes, other people who help them. And these guidelines come up every 5 years, right? Mm-hmm. So this is actually the year 2018, and we'll have them next month, within the next 2 weeks. I'm sure you're very busy with the preparations for that. So taking time out, I'm very thankful for you for doing that. Now, these guidelines, until now, we've not had a specific part of the guideline be focused on Ramadan as such. And so in that sense, when we started talking about this position statement, we thought this was going to be complementary to the guidelines that come out every 5 years from Diabetes Canada. Can you elaborate on that part?
Yes, so first of all, our guidelines will be released April 9th. So these are the 2018 guidelines. And after this year, we will be updating our guidelines annually, but it won't be the entire 38 chapters that will be released on April 9th. So we are really excited about this position statement in particular, because we really understand that this stakeholder group needs attention. We really were not able to do the work that needed to be done, so we are really happy to collaborate with this group, and we'll be able to help disseminate the recommendations and the position statement once it's published.
On behalf of Jan Hurks or yourself, would you like to give a parting message?
So we are just glad that this is being done, and we hope that in the future that we'll be able to incorporate this position statement into our guidelines, because the first process in adding new chapters to the guidelines is to have a position statement developed. So you're way ahead of the game. And so once that is done, then we will look at how much more literature gets published on that topic, and then hopefully in the near future have a chapter on this in our document.
Yeah, and hopefully this will also generate more research into the area, as was mentioned by previous faculty, that there's not a lot of research in Ramadan in Canada, and so that's where we need to generate some research as well, so that we can actually be confident in our recommendations much more in Canada as well. So thank you so much, Jovita.
Pleasure.
Okay, thank you, Dr. Bajaj. It's a pleasure to be here. My name is Hisham Mahmoud. I'm the head of medical affairs for Sanofi Canada. And again, very proud to be part of this initiative.
Excellent. Thank you so much. And Hisham, tell me about your life story. Were you born in Canada, or when did you move into Canada?
Okay, so I'm Canadian since 2010. However, I was born in Cairo, Egypt. The last 20 years of my life before coming here to work for Sanofi Canada, that was like 1 year back, was spent in Dubai. So I've been again working in Sanofi Middle East platform and Central Asian countries.
Yeah.
I'm a medical doctor by education. I was graduated from Cairo University in 1994. I had some postgraduate education in general surgery, actually, and thereafter in oncosurgery as well.
Oh, excellent.
Yeah.
So as a doctor and as a Muslim, right?
Yeah.
You've been fasting for Ramadan yourself, and what are your experiences fasting in Egypt, in Dubai, versus fasting in Canada?
Yeah, okay. So that's a very interesting question, Harpreet. Thank you. So Egypt was basically the childhood fasting. So that was basically, there were a lot of tradition. It was a lot of fun, I have to say. When you grow up in your professional career, so this is more on Dubai and thereafter Canada, it's basically the how to juggle your professional life with fasting, and you need to get a bit organized when it comes to that regard. What Canada have factored into this equation are the long fasting hours.
Let me interject. So in the Middle East,
Yeah.
or in majority Muslim countries,
Yeah.
The peers, all of the peers are fasting during that month, right? And does that help, or do they get shorter work hours during the fasting month as well? And does that help as well?
So that's a very good point. So you get like a flexi hours. So the total number of hours are more or less the same, but you can have some flexibility on when to start and when to end your working day, so that you can basically provide some flexibility to attend to your fasting practices. But that's being said, again, I think that in terms of everybody around you, again, my last 20 or 20 plus years were in Dubai, where it's a very, I would say, diversified culture. So there were a lot of my colleagues were fasting, but still, again, we had a big number of colleagues that not of Muslim faith. Yeah.
Mm-hmm. And so you were talking about the long hours in Canada, and did you fast last year?
So yes, I did. So I've experienced that last year, and indeed, maybe the first few days you might find it difficult to get used to it, but I think after the first week, it kind of normalized, and
So you've done well.
You take it as it comes.
बहुत शुक्रिया जी आपका मुझे ये अपॉर्चुनिटी देने का। बेसिकली स्टॉप डायबिटीज़ फाउंडेशन और डायबिटीज़ कनाडा के इश्तराक से हमने पहली कैनेडियन पोजीशन स्टेटमेंट जारी की है, ताकि लोग जो रमज़ान मुबारक में रोज़ा रखना चाहते हैं और जिनको डायबिटीज़ या ज़ियाबतीस का मर्ज़ लाहक है, वो किस तरह से एक सेफ़ तरीके से रोज़ा रख सकते हैं। इस सिलसिले में हमने रहनुमाई ली है इंटरनेशनल डायबिटीज़ फाउंडेशन की गाइडलाइन से, और ये पोजीशन स्टेटमेंट जारी की है, जिसमें बताया गया है कि कौन लोग उनके लिए किसी किस्म की कोई ममानियत नहीं है फास्टिंग करने के लिए, वर्सेस वो लोग जिनके लिए डायबिटीज़ की वजह से कुछ चेंजेस करने की ज़रूरत है उनके लाइफस्टाइल में, फ़िज़िकल एक्टिविटी में, उनकी मेडिकेशंस में, दवाइयों में, और या इंसुलिन में। तो ये उस सिलसिले की एक पहली कड़ी है। इसमें डायबिटीज़ एजुकेटर्स, मुख्तलिफ डायबिटीज़ स्पेशलिस्ट इन्वॉल्व हुए हैं और साथ साथ कम्युनिटी की इन्वॉल्वमेंट, कम्युनिटी में मजहबी रहनुमाओं की इन्वॉल्वमेंट है। और इंशाअल्लाह रमज़ानुल मुबारक से पहले हम ये गाइडलाइंस जारी करेंगे और मुख्तलिफ मसाजिद में, इबादतगाहों में, फैमिली फिजिशंस ऑफिसेस में इनको डिसेमिनेट करेंगे ताकि मैक्सिमम लोगों तक ये गाइडलाइंस पहुंचाई जा सकें और वो आराम से एक सेफ़ तरीके से रमज़ानुल मुबारक में रोज़े रख सकें। बहुत शुक्रिया।
Assalamu alaikum. My name is Taysir Bahassan. I'm an endocrinologist from Windsor. I've been involved with diabetes in Ramadan for the past 7 years. The reason why I got interested in Ramadan and diabetes because my mom had diabetes since she was 40 years old, and she was on insulin during Ramadan, and she kept on having low blood sugars during Ramadan. And, afterwards she stopped her medication altogether and she started having high blood sugars. And so she found Ramadan very difficult. So when I became an endocrinologist, this area became special interest for me to sort of help my mom and other Muslims fast in Ramadan and try to help and make it safe for them. I think the one thing that we should keep in mind is that in the Quran it says that if you have an illness and it's going to be harmful for you to fast in Ramadan, you shouldn't fast. Despite that, many Muslims do decide to fast, and as a physician, we try to support them during their decision to fast in Ramadan, try to make it as safe as possible for them. The other thing we should also keep in mind is that people fast for so many reasons. Religious is the basis reason, but a lot of times there's social belonging that sort of want people to fast. You see the whole family fasting and they want to sort of belong with them, and so that's what sort of motivates them to fast also. And sometimes it's peer pressure. They don't want to sort of have their family see that they see their children fast and they say, oh, how come daddy's not fasting or mom is not fasting? So there's also that pressure that goes along with it. But majority of people fast because of religious reasons, and we try to support that decision. In general, most people who have diabetes can fast safely during Ramadan, and they should be assessed by a healthcare provider to sort of, make sure that it can be as safe as possible for them. The ones that are sort of at increased risk are people who are on medication that cause low blood sugars. So those medications include insulin and medications that we call sulfonylureas or insulin secretagogues. These are pills that sort of make your sugars go low in terms of dimicron and glyburide. The vast majority of medications are safe, which include metformin, DP4 inhibitors, SGLT2s, and GLP-1 agonists. These are all medications that sort of have been used during diabetes care and have been shown to be safe both outside Ramadan and during Ramadan. The other sort of caveat in terms of medications that have to be care of are the SGLT2s, are medications that are sort of newer in diabetes care and have helped people lower their blood sugars without the risk for low blood sugar and help them lose weight. This medication works by making you pee out extra sugar whenever you're high, and which is a great way to sort of control your sugars. But during Ramadan, this can cause increased dehydration. So people who are at increased risk in terms of dehydration should be careful and sort of make sure they keep themselves hydrated. And that's for all people fasting during Ramadan, should worry about hydration. The other medication that we also talk about that need to have special care are the GLP-1 agonists. And these sort of medications are injectables. They help you lose weight, control your blood sugars, and there's low risk for hypoglycemia. But the biggest side effect is nausea, and you don't want to start this medication before or during Ramadan, as it can sort of interrupt your fasting. So the three medications that you have to worry about during Ramadan are the secretagogues that can cause low blood sugars, the SGLT2s which can increase your risk for dehydration, and the GLP-1s can increase your risk for nausea. And of course you have to worry about insulin, which can also cause low blood sugars. The last thing I want to touch about is monitoring. And a lot of people don't like to monitor blood sugars during Ramadan because they're worried about if they see a low blood sugar, they'll have to break their fast. So a lot of people don't check their sugars during Ramadan because they don't want to see a low blood sugar, which would encourage them to break their fast. So again, what we started off is that the point about Ramadan is that Allah wants you to fast, but He wants you to do it in a safe way. And so if you're having a low blood sugar, it's not safe for you to continue fasting, and you should break your fasting at that time. Thank you very much.
आप देख रहे हैं टोरंटो 360 टीवी
और हम वापस आते हैं कमर्शियल ब्रेक के बाद।
आप देख रहे हैं टोरंटो 360 टीवी। जाइएगा नहीं, हम ब्रेक के बाद वापस आते हैं।
आप देख रहे हैं टोरंटो 360 जो कनाडा का सबसे नंबर 1 चैनल है। अभी हम आएंगे वक्फे के बाद, जाइएगा नहीं, चाय पीते रहिएगा और हमें देखते रहिएगा। थैंक यू।